In general terms, prolapse means that a part of our body slips or falls down out of its correct anatomical position. And for pelvic floor disorders in women or for uterovaginal prolapse, it means that vaginal walls and or the womb descend down through the vaginal canal. Women experience this as a feeling of a discomfort and a bulge down below, often described as feeling a tennis ball or even hard-boiled egg-like sensation. The prolapse is categorized according to its vaginal wall compartments, and these are the front, the top, and the back. Each of these compartments has got neighboring organs, i.e., the front is the bladder, the top the womb, and the back there is the bowel. The prolapse severity is categorized in stages, from the least severe, i.e. stage 1, to the most severe, stage 4, that is often called precedentia. Vaginal prolapse is a very common condition, especially in my clinics. And from the research, it is believed that up to 40% of parous women develop symptoms of prolapse. However, that number is believed to be underrepresented. So what are the risk factors for prolapse? It is believed that pregnancy is associated with prolapse symptoms, and the first pregnancy increases the risk by 4 times of developing such symptoms. Second pregnancy, it doubles it, then the number goes to 8. Then another factor is delivery, mode of delivery, whether it's a vaginal, instrumental, or even cesarean section. Furthermore, chronic pressure delivered on pelvic floor in a way of chronic constipation or chronic cough. Furthermore, obesity. Overweight and obese women have more prolapse symptoms than their normal weight counterparts. If a lady had a previous pelvic surgery, for instance, for cancer, the treatment was supplemented with radiotherapy, will develop prolapse symptoms. And finally, aging and the menopause, as the lack of estrogen is also associated with worsening prolapse symptoms. The new kid on the block is the epigenetics, so genetic studies that are trying to find the link between pelvic floor disorders, i.e. prolapse symptoms, and the genes. And few genes were identified that are associated with this condition. However, it is still early stages to recommend any genetic treatment for the prolapse. Vaginal prolapse is often described as a discomfort and rubbing sensation in the intimate areas that when women are having shower or on the toilet, experience a feeling of a bulge. They describe it as sitting on a golf ball or a tennis ball. The physical discomfort can be associated with other symptoms, i.e. with urinary incontinence, with difficulty in emptying bladder, and or difficulty in emptying bowel properly. It is very important to note that this bulge can affect intimate life of a lady, that also has a huge psychological impact on her well-being. Often women described as they do not feel as complete women anymore. There are 4 ways of approaching treatment for the prolapse. I cannot emphasize enough how important supervised pelvic floor exercises are, and with the help of specialist urogynecology nurses or pelvic floor physiotherapists, a successful pelvic floor rehabilitation can be achieved. Women who have gone through the change, i.e. the menopause, can use vaginal estrogens in a form of a pessary or a cream that will help with urinary symptoms and ease the vaginal discomfort. Medical devices are also used in a form of pessaries, and there are different types and designs of these devices. And finally, the operation. There are a number of procedures that can be discussed with the patient who considers a corrective prolapse surgery. Operations for vaginal prolapse are aimed to improve quality of life of an individual. Therefore, it is very important to establish a meaningful dialogue between the patient and the clinician to understand the severity of the symptoms and the patient goals in order to provide a successful treatment. When this operation is necessary, well, I would say it is necessary in a scenario when the women cannot pass urine and go into so-called urinary retention, whereby the urine tracks back out onto the kidneys called hydronephrosis. Otherwise, as I said, it's a quality of life operation, and the decision when to operate is very individualized.